Section 1. A New Hope, Mental Health and Metabolic Psychiatry. Mental health disorders are increasingly prevalent, affecting millions worldwide. These conditions range from anxiety and depression to more severe disorders like schizophrenia and bipolar disorder. The impact on individuals and their families can be profound, leading to a diminished quality of life and even physical health problems. Traditional treatments, while helpful for some, often fall short. Medications and therapy can alleviate symptoms, but they don't always address the root causes. This leaves many patients feeling frustrated and hopeless, constantly searching for more effective solutions. This leaves many searching for alternative solutions. People turn to self-help books, online forums, and various holistic approaches in hopes of finding relief. The quest for better mental health is ongoing and ever-evolving. Emerging research points towards a fascinating link between our metabolism and our mental well-being. Scientists are discovering that the way our bodies process energy and nutrients can have a significant impact on our brain function and emotional health. This new field, called metabolic psychiatry, offers a fresh perspective on understanding and treating mental health conditions. By examining the metabolic processes in the body, researchers hope to uncover new pathways for treatment that go beyond traditional methods. Metabolic psychiatry explores the intricate relationship between our physical health and our mental state. It emphasizes the importance of a holistic approach, considering both the mind and the body in the treatment of mental health disorders. It delves into how our body's metabolic processes, the way we process energy and nutrients, can directly impact our brain function and mental well-being. This includes looking at diet, exercise, and other lifestyle factors that contribute to overall health. This approach recognizes that mental health is not solely confined to the brain, but is intertwined with the overall health of our body. By addressing metabolic health, we can potentially improve mental health outcomes, offering hope to those who have struggled with traditional treatments.
Section 2. The Mind-Body Connection, Metabolic Psychiatry Explained. Metabolic psychiatry is a new way of thinking about mental health. It goes beyond traditional approaches that focus solely on the brain. Instead, it considers the intricate relationship between our body's metabolic processes and our mental well-being. This field explores the profound connection between the body's metabolism and the brain. It delves into how the energy we derive from food and the efficiency of our cellular functions can influence our mental state. Metabolic psychiatry suggests that imbalances in our metabolic processes can significantly contribute to mental health challenges. These imbalances can manifest in various ways, affecting our mood, cognition, and overall mental health. Metabolic processes involve how our bodies use food for energy and how our cells function. These processes are crucial for maintaining the body's overall health and ensuring that the brain receives the necessary nutrients and energy to function optimally. When these metabolic processes are disrupted, it can have a profound impact on the brain's ability to function properly. This disruption can lead to a range of mental health issues, from anxiety and depression to more severe conditions. Imagine our brain as a complex machine with countless interconnected parts. Each part needs to work in harmony for the machine to function smoothly. Like any machine, it needs the right fuel and regular maintenance to run efficiently. The fuel for our brain comes from the nutrients and energy provided by our metabolic processes. Metabolic psychiatry suggests that when our metabolism is out of balance, it's like putting the wrong fuel in a car. The car might still run, but it won't perform efficiently, and over time, it will develop problems. Similarly, when our metabolic processes are not functioning correctly, our brain might still work, but not at its best. This inefficiency can lead to various mental health issues, making it harder for us to cope with daily challenges. Metabolic imbalances can disrupt the brain's delicate balance, potentially contributing to mental health issues. By understanding and addressing these imbalances, metabolic psychiatry aims to improve mental health outcomes and enhance overall well-being. Section 3. The culprits: insulin resistance, inflammation, and oxidative stress. Three key metabolic processes often implicated in mental health are insulin resistance, inflammation, and oxidative stress. These processes are interconnected and can have a cascading effect on our bodies, including our brains. Let's break down each process and its potential impact. insulin resistance occurs when our cells become less responsive to insulin, a hormone that regulates blood sugar levels. This can lead to elevated blood sugar, increasing the risk of type 2 diabetes and other health problems. Importantly, insulin resistance can also affect the brain, potentially contributing to mood swings, fatigue, and difficulty concentrating. Section 4. The metabolic impact, mental disorders and metabolic dysfunction. In this section, we will explore the intricate relationship between mental health and metabolic processes, shedding light on how these two critical aspects of our well-being are interconnected. Metabolic dysfunction can manifest in various mental disorders, including depression, anxiety, bipolar disorder, and schizophrenia. These conditions not only affect mental health, but also have profound implications for physical health, creating a complex interplay that can be challenging to manage. While the exact mechanisms are still being researched, studies suggest a strong correlation between these conditions and metabolic imbalances. Researchers are delving into how metabolic dysfunctions, such as insulin resistance and chronic inflammation, might contribute to the onset and progression of mental health disorders. Let's delve into how these disorders are linked to metabolic health. Understanding this connection can help in developing more effective treatment strategies that address both mental and physical health aspects. Depression, often characterized by persistent sadness and loss of interest, has been linked to insulin resistance and inflammation. These metabolic issues can exacerbate depressive symptoms, creating a vicious cycle that is difficult to break. Studies have shown that individuals with depression often have higher levels of inflammatory markers in their blood. This chronic inflammation can affect brain function and mood regulation, further complicating the treatment of depression. This suggests that inflammation might play a role in the development and severity of depressive symptoms. By targeting inflammation, we might find new ways to alleviate some of the burdens of depression. Similarly, anxiety disorders, marked by excessive worry and fear, have also been associated with metabolic dysfunction. Addressing these metabolic issues could potentially reduce anxiety symptoms and improve overall mental health.
Section 5. Ketogenic diet, a shift in metabolism. The ketogenic diet, a high-fat, low-carbohydrate eating plan, has gained significant attention for its potential benefits in various health conditions, including mental health. This diet forces the body to shift its primary energy source from glucose derived from carbohydrates to ketones produced from fat. Typically, our bodies rely on glucose for energy. However, when we drastically reduce carbohydrate intake, as in the ketogenic diet, our bodies enter a metabolic state called ketosis. In ketosis, the liver begins breaking down fat into ketones, which serve as an alternative fuel source, especially for the brain. This metabolic shift can impact brain function and potentially alleviate some mental health symptoms.
Section 6. Ketogenic diet and mental health, promising research. Recent research suggests that the ketogenic diet may offer a new avenue for managing mental health conditions. While still in its early stages, studies have shown promising results, particularly in individuals struggling with conditions like depression, anxiety, and bipolar disorder. A study published in the journal Psychiatry Research found that individuals with depression who followed a ketogenic diet for 6 weeks experienced a significant reduction in depressive symptoms compared to those following a standard diet. These findings suggest that the ketogenic diet's metabolic effects, such as reducing inflammation and improving brain energy metabolism, might contribute to improved mood regulation.
Section 7. A personalized approach, medical supervision and further exploration. While the potential benefits of metabolic psychiatry and the ketogenic diet for mental health are exciting, it's crucial to approach these interventions with caution and under the guidance of healthcare professionals. Self-treating mental health conditions can be dangerous, and it's essential to work with a qualified healthcare provider to determine the best course of action. Individual responses to the ketogenic diet can vary, and it's not a one-size-fits-all solution. Factors such as medical history, current medications, and individual needs must be carefully considered. Consulting with a healthcare professional or registered dietitian experienced in metabolic psychiatry and ketogenic diets is crucial for personalized guidance and monitoring.